Thank you very much. Good day and welcome to this Day 2 SCAGO Summit 2023 session. I am Dr. Soji Jemitola from SCAGO and I will be your moderator for this session. We are on the advocacy track and our topic this afternoon is effective advocacy with governments, hospitals, and workplaces, which will be presented by both Devan Sommerville and Harprit Gill. Devan Sommerville will first share general principles that we can apply to ensure that we are heard effectively, and then Harprit Gill will delve deeper into specifics of advocating within the workplace. I can tell you this is sure to be an empowering session. A few housekeeping guidelines, first of all. This session is being recorded and will be made available on the SCAGO website, which you can access at sicklecellanemia.ca. Note that the information shared during this summit does not constitute medical advice, nor replace your health professional's recommendations. To support an optimal learning environment, your microphones have been muted. If you would like to ask your question verbally during the Q&A section, please raise your hand using the reaction section at the bottom of your screen, and I'll ask you to unmute yourself. This will only occur during the Q&A session. However, do feel free to share your questions or comments in the chat even during the presentation. These will all be shared with our speakers to respond to during the Q&A section. Towards the end of the session, SCAGO will also be sharing a brief poll with you. Please complete the poll to share your frank feedback about the presentation. SCAGO recognizes that the summit is of interest to a diverse audience. I am therefore pleased to let you know that you can have this session captioned in your preferred language. To activate, click Show Caption at the bottom of your summit screen, select the Enable Translation checkbox, and finally choose your preferred language. We will be kicking this session off with Devan Sommerville. I'll introduce him. He will do his presentation, then I'll introduce Harprit. A little bit about Devan. Devan is an experienced government relations advisor with extensive experience on behalf of clients in the healthcare sector, including patient advocacy groups, and has supported SCAGO in its Ontario government relations efforts since 2020. And SCAGO thanks you, Devan. Prior to joining Counsel in 2014, Devan served as a senior policy advisor responsible for land use planning and development for 2 Ontario ministers of municipal affairs and housing. He also formerly served as an advisor and special assistant to the Minister of Labour and the Premier of Ontario. Definitely a strong panelist, well placed to give us insights to effectively making our voices heard. Here is Devan Sommerville.
Hi, everyone. Thank you very much for joining us this afternoon. I'm just going to open up the presentation and share my screen momentarily. So hopefully everyone's able to see the slides that I'm sharing on screen here today. And as Dr. Jemitola had shared, I really wanted to share with you a little bit about good principles of effective advocacy. And as was noted, I work in government relations. So when I talk about advocacy for my own professional life, I really am focusing on talking with government, talking with elected officials, talking with members of our civil service, provincially for the most part in my case, but certainly federally and at other levels of government as well. But really, what I wanted to try to communicate to you today was that there's a lot of common principles around advocacy and what's effective advocacy that I think are universally applicable and apply to a lot of different contexts. They certainly might apply to a government audience, but they apply to individuals in their own lives, their own personal lives, their own interactions with other institutions and other organizations and entities that you may be interacting with on a daily basis, either on your own behalf or on behalf of your family and loved ones, or on behalf of the community of individuals living with sickle cell disease across Ontario. So in terms of this question of advocacy and what it really is, I'd like to start off by just reminding everyone that, advocacy is really, generally speaking, an activity by either an individual or a group that's trying to influence decisions within some sort of system or institution. As I mentioned, that could be political or government, but it could be economic, it could be social, it could be education, it could be the healthcare system. And it is really a recognition that we all do have the ability to affect change, big change and little change, personal change and systemic change. And the effectiveness of our advocacy is what's going to really lend itself to that. Usually when we're talking about effective advocacy, certainly when we're talking about it from a government relations perspective, but I think in general, there's a lot of common principle to this, is that there are three key ingredients. First, you have a good case. You have to have that good case for what you are trying to advocate for. That really is going to be grounded in your facts and your arguments. Why do you need this? What are the reasons? What is the evidence that you have to support that with? But information alone is not going to be sufficient. We face many experiences in our world where people looking to speak with government are going to be feeling very frustrated by the fact that they feel their own case is self-evident and that they have incredibly strong reasons for believing or supporting whatever change or issue that they support, and are frustrated by the fact that the government isn't engaging with them. And sometimes that is because they need to also have a well-presented case. You need to have a clear message that's well presented and well communicated to the audience that you're looking to engage with. And that is going to reflect a need to really understand who that audience is and what they are motivated or incented by. So I'll talk a little bit more about audiences to come, but it's good to remember that presentation really matters in advocacy, whether we're talking about going to government or talking about intervening on yours or a loved one's behalf at a very momentary issue. But then there's also the timely case, that you want to make sure that your case is delivered at the right time to maximize its impact. When we're talking government relations or engaging with government about systemic change, that right time can be dictated by a whole host of things about the political cycle, what the government's priorities are, where we are between elections, any number of variables. But that timely case question is also very relevant to your own interactions on a daily life. And that is going to differ dramatically depending on the type of system you're interacting with and the issue in question. I think it all comes down initially, though, to this question you have to ask yourself, which is, what are you asking for? And effective advocacy means knowing what you want and then being focused and realistic in your expectations. So you need to have a clear priority. Oftentimes, advocacy can sort to break down into a situation of communicating the problem and telling a very long and complicated story of how that problem has reached this point. That's all very, very important information, and especially very personally important to you as an advocate. But it doesn't necessarily mean a lot to the individual you're advocating to. They need to clearly understand what your priority is at that point in time. Why are you engaging with them? They do need context, but that context has to be synthesized or has to be simplified in such a way that it's clear to see why that context is immediately relevant to the priority you're seeking. As well, you need to have your audience in mind, and we'll talk more about that. But your audience, who they are, what they are doing, and the means by which they can help you are going to vary. They're going to depend, and you need to think about your advocacy in that way. So with this question of who your audience is, so you need to recognize that your audience is critical to effective advocacy, and recognizing it is critical to effective advocacy. If I were to use the same approach in my line of work with every single person I engaged with, I wouldn't be very successful, because every one of those individuals is going to be influenced by different factors. They're going to be subject to different demands, and they're going to be able to help or assist in different ways. So that's important for you as much as possible to understand their role, their impact, and how they can help or affect your situation or the situation more generally. And who in that organization is best positioned to affect change or champion your issue. So if you were to think about something very separate from what I do, if you were to think about the healthcare system, for example, is this a situation where you're having to advocate in crisis or on behalf of a loved one in crisis? Is this about something where you've had the opportunity to step back and think about how care needs to improve? Who is the individual you are engaging with? What are their ability to change things or influence things in a positive direction? So having that understanding is important, and doing some of that work ahead of time, even before you need to advocate, is going to help you in a big way. And remember, the frustration you may encounter is understandable, but those long-term relationships matter. They really do. It's just human to want to help people that you either like or respect. And it is very demoralizing to help people that you feel don't appreciate the help or don't feel willing to understand what you as the audience are going through or dealing with. And I understand fully that in many cases, that's really difficult in the moment, depending on the type of issue you're working on. But I think that's also why it's important to think about some of these things before the crisis arrives from an advocacy perspective, so that if you find yourself in those circumstances or a loved one in those circumstances, you know how to best bring this forward in an effective way. And as I said, that's not always simple or easy, and it is going to vary depending on the type of audience you're looking at. Obviously, a crisis in an emergency room is going to be very different from it as an advocate than something where you've had time to think about it, bring forward your best case, and prepare very detailed work in advance. So that's why I sometimes like to think about an advocacy team. For many individuals, especially when we're talking about something like a life affecting condition like sickle cell, you want to have an advocacy team. You know, who is that umbrella of people that are part of your advocacy network? That might be family and friends who are trusted and empowered to help speak on your behalf and know what your objectives are, or that you can bring them to support the work that you're doing on behalf of either a loved one or the community more generally, or your organization. Are there healthcare practitioners, people, not just healthcare practitioners, but third-party experts who can bring credibility, who can speak to an individual case, or who can validate what you're bringing forward? You may also have trusted colleagues or supervisors, people that you can genuinely entrust in, that if you're working within a system, an employer, for example, an education system, that you know can help take your case forward and help to bring additional credibility to what you're doing. The ideal situation being, though, is that these individuals are empowered. They know what your priority is, they understand the context, and they can help you determine how best to bring that to that audience, or to do it for you, or for a loved one, or a colleague, or otherwise, who's not able to do that in the moment. So then we talk about effective advocacy interactions. So actually getting to the point of being in an advocating situation. And this could be your scheduled meeting. This could be a phone call. It could just be a situational interaction that you have in a day-to-day life. It may be unexpected, but it may be a public engagement. It may be somewhere where you are engaging directly with people. And I think there's some universal principles that are helpful here. Staying focused. Again, back to priority, critical context. What is the outcome that you need? Trying to keep it as simplified as possible. And that's where having a team around you, if you are not in a position to do that, who can do that on your behalf, knows what that needs to be. Being as polite and respectful as possible, which can be very hard at times when you don't feel like you're being listened to. But there's no situation I can think of where turning that on its head ultimately leads to a better outcome. Providing practical and achievable recommendations for action, whether it's a small thing or a big thing, giving people clarity about how they can help resolve the issue or help improve the situation that they can act on is critical. So many times in my work, when I've both been on both sides of the table from a government perspective, I have had these conversations where people will give me tremendous amounts of information, but no actions that I can take. So I'm left to kind of try to figure that out for myself. And what I figure that out to be might not be very correct. So you want, as possible as well, to give precise examples, documented experiences. When you have time to prepare, what are those compelling examples that you've had where things were not done in a way that was helpful or beneficial or positive? And if it's in the moment, it's obviously knowing how to communicate how either situations have been better addressed in the past or how they ought to be addressed going forward. As I've said before, understanding your audience, doing the homework as possible. Taking notes, obviously that's not going to apply in all situations, but certainly if it's a controlled, planned meeting, prepared meeting, keep a record for yourself of what was discussed. Don't leave there with a different understanding than that other individual may have had, and try to confirm that with them before you leave that interaction. And always take the initiative to be continuing that discussion and staying in touch. Never expect that you've had the conversation, therefore it's on them to fix it and they'll go do it. And then if they don't, they've failed. people are so easily dragged away by other immediate priorities. We've all seen this in our own lives. So remember that, don't give them the chance to fail you by not being persistent. And reward positive action. And I don't want to sound patronizing with this, but when people do take a positive step to assist you, even if it's not the full extent of what you ultimately want, be thankful, be positive, be supportive of the actions they have taken, and keep working towards the rest of that priority, because people are going to want to continue to help in any of these sort of institutional settings if they feel like their initial efforts have made progress. If they feel like everything is never enough, it becomes very easy to get tuned out. And that is one of the most cardinal rules we'll talk to people who come to us from a government engagement perspective is don't be constantly bringing problems without recognizing positive action, because it can so quickly lead to a lack of interest in trying to help you going forward. Supporting materials can be helpful. Now, these could vary. Obviously, in a set meeting where you're going to be sitting down face to face, they're going to be very formal. If it's in a more crisis type situation, I think they've got to be very simple, but they should clearly communicate what your goals are. They should be concise and practical. They should be practicable as well, meaning that somebody can look at that and know what the actions have to be taken here, or at least to deduce what those actions are based on the outcomes you've described. They need to be easily accessible. So if you're going into a meeting, they should be printed out in advance. They should be shared ahead of time if relevant. If you're in a direct interaction, you or your sort of advocacy team ought to know where they are on your person, in your possession. Do other people have a copy if they need to be able to provide that at a very quick notice? And have references and contacts. How can somebody get back in touch with you or to somebody else that you trust or that you work with? And really, there's some golden rules here. You are always going to be so much more knowledgeable about your condition, your loved one's condition, the conditions of those that you're working on behalf of than your audience. You will always have more information than them, and it's important to understand that. Don't expect them to know things that you know so well because they haven't walked in your shoes or in the shoes of others that you care about. And being patient with them in that regard is going to matter, or bringing the information to them in a way that they can connect with and absorb will be helpful. It's really important not to assume malice when ignorance or incompetence will do. That was one of the first things I was taught in government relations, is it's so easy to feel personally targeted when people are just ignorant or not very effective at doing what they do, at least in terms of helping you. And of course, being loud and frustrated does not equal effective and successful. So often in our world, we do have to bring people to a place where they can be persuasive and direct without getting more frustrated and engaging in more direct action. It's a human instinct that we all have to want to confront our problems and get our voice heard. But there are definitely ways to do that are not flinching from things that need attention, but don't create the kind of confrontation that leads to people taking sides or people tuning you out. And that's the last thing you want to have happen as you're trying to advocate. Thank you.
Thank you, Devan, for sharing those insightful and valuable strategies, right from making sure we're talking to the right audience to knowing that audience and adapting our messages with clarity, not just in the message we're delivering, but the action that we request, and then having a follow-up plan and making sure that we have some level of appreciation for whatever is achieved. Thank you very much, Devan. Dear audience, do feel free to post your comments and questions for Devan in the chat. They will be answered during our upcoming Q&A section. For now, we'll hear from our second panelist, Harprit Gill. Harprit Gill is a registered social worker with a master's in social work from the University of Toronto. Harprit has 14 years of experience in both community and hospital settings. Since the inception of the Adult Sickle Cell Clinic in 2017, Harprit has been offering psychosocial support to individuals in the sickle cell community at Brampton Civic Hospital. Harprit also supports individuals who are connected to the outpatient oncology and palliative care program. She is passionate about strengthening and improving access to mental health services and promoting mental wellness in the sickle cell community. It is definitely my pleasure to now hand over to Harprit, who will be taking us to advocating effectively in the workplace environment. Harprit?
Thank you. Hi, everybody. I'm just going to share my screen. All right, terrific. So I am not sure if we can see my screen.
Yes, we can.
Can.
Just put it in the presentation mode though.
Thank you.
Thank you.
My first time doing this, everyone. All right, are we good?
Yes, we are. Thank you very
Okay.
much.
Thank you. So as shared, my name is Harprit Gill. I'm a social worker in the Adult Sickle Cell Clinic at Brampton Civic Hospital. And today I'm going to be talking to you about sickle cell disease in the workforce. What should you reveal from the get-go? So I'm talking to you as a perspective as a social worker. And so just a quick legal disclaimer that information in this presentation is not legal advice, but a reflection from me as a social worker. So what should you reveal? Often this is a very difficult question. And at first it may seem very easy to make a decision, but as we weigh out the pros and cons, it can cause many conflicting feelings. And people often ask if they should reveal everything, something, or nothing. And what are the right details? But this is a very personal decision, and it's important to remember what's right for somebody else may not be right for you. And you might find it to be helpful to reflect on your values, your past experiences, and your expectations for future outcomes. So then how do we figure this out? It might be helpful to go inward and ask ourselves some questions. So some questions that we can reflect on are, and you're also welcome to share in the chat box if you think you have any recommendations or suggestions or examples that you think might be helpful. But the first one I'm going to start off with is the need for accommodations for success in your role. So this could be the hours that you work, the space that you work in, the time frame that you might need to hand in projects. Other accommodations you might need maybe regarding medical appointments. So will you need time off or will you need extended time off? What about sick days? So often agencies have a set policy for how many days that they have. Perhaps you might need an exception to that. And then I also want you to think about previous employment. So when you were working your previous jobs, did your illness require you to take time off? Did it impact your performance or your success? Reflecting on the past is important to help us to think about what we might need in the present. And then for those who don't have any previous work employment experiences yet, reflecting on your schooling, if you were doing volunteer work, what helped you at that time? How did you communicate to your school about your illness? Did you need specific accommodations? Were there certain things in your role, if you had an internship or in a certain course or volunteer role where you felt like you had a difficult time? What did you need for support? What helped you to receive when you did receive support? And then my fourth point here is to think about this organization that you have joined. Do they have a human resources department? Do they have an occupational health department? Often knowing that you have these resources, they are institutions or places that you can speak to inquire about what information might need to be divulged. And I wanted to also take a quick moment to say we shouldn't forget about AOTA. So AOTA stands for the Accessibility for Ontarians with Disabilities Act. It was created in 2005, and it's an Ontario law that mandates organizations must follow standards to become more accessible to all people with disabilities. So this is government, nonprofit, and private sector in Ontario that has one or more employees. And it doesn't matter if you're full-time, part-time, contractor, seasonal, everybody is included. So for more information, don't forget to go to www.aoda.ca. And then I felt like this was a very important piece to mention as well too, and it'll be throughout my presentation, but focusing on your mental health. So are you already feeling anxious and worried about the new job? This is a very normal feeling, especially when you're starting something new. I think we've all gone through that feeling, but our mental health does not need to be black or white. Every day we are a range of emotions, but what might help us is to reflect on our personality and our mental health and how we usually handle decisions, especially in the past when we've had to share medical information. And I want you to also think about how have you felt when you've disclosed to somebody who's been in a position of authority or power, because preparation can help soothe your anxiety and help you to feel a little bit more empowered when you have to advocate for yourself. Okay, so in these slides, I want us to think about how do we decide what to reveal, especially in the beginning. And so it might be helpful to think about a few of these points, and I'll elaborate a little bit more. So the first point is job responsibilities and tasks required. So consider the work that's being performed. Is it a desk job? Will you be sitting or standing a lot? Is it a high stress setting? Is it possible that you might need some accommodations due to one of your tasks? And then environment. So if you're working outdoors, will you have extremes in temperature? We know that for many sickle cell patients, extremes do affect patients. So what will that be difficult for you? Will you require accommodation? And then even if you're indoors, if it's a very fast-paced environment that requires a lot of juggling of different tasks with very few breaks, you have to ask yourself, will that be a challenge for me? Is that something that I need to address? And then my third point is health history. So, this is an opportunity to think about specific health events that have been barriers for you in the past, or areas where you may think you may have a concern. For example, you might have an upcoming surgery and that might impact your work responsibilities or availability. And then mental health is key. So thinking about how have you been throughout your life? Are you typically an anxious or worried person? Is it hard to self-soothe yourself when you're feeling unwell, or will you need accommodations? And I brought up past experiences again, and I'm repeating it because it is important to think of the past. Did you disclose to somebody who was in a position of authority? Were there pros and cons to you sharing this information? Did you feel better? Did you feel worse? So thinking about, each of these points may help you to think about what you might want to divulge. And then just adding on to these points, I wanted to talk about agency size. So if you're with a small agency, this might mean you're a more close-knit work environment and more people are impacted if someone from the team is unavailable. So it might be helpful to reveal to the employer a little bit more information so they have context and can figure out how to support you in a small team environment. But in a large organization, your direct manager may not be aware of your illness because you have an occupational health department that would require certain information regarding your illness and what accommodations you may need. So, it might really depend on what you share because of, the way that you are working in your agency and their size, or my next point, which is working with others. So, what you might want to think about is, does my absence make an impact on the team? Maybe you're a cashier for a large retailer, and if you call in sick or you're not available for a certain number of shifts, it won't matter because they can fill in those positions or manage without you. But if you work alone, do you have job flexibility to attend medical appointments because you make your own hours? Maybe it's not relevant for you to share because you have that flexibility and it doesn't really make a difference to your workflow. But if you're the only person providing a service, would your absence have a significant impact on the organization? So if your employer, whether they're small or large, often we might be the only one in our, for example, in my clinic, I'm the only social worker. So if I'm not there, that would have an impact on the patients that are being supported. So it may be helpful to share with your employer about, if you're going to need some accommodations, so that way they can help you with deadlines or give you extra time if needed. So coming back to mental health, because it's important to reflect on our own mental health needs when it comes to disclosure about illness. If you are feeling anxious, worried, or scared, then it might be helpful to think about, do I need accommodations? And so what can help is to think and reflect on the employer's policies for sicknesses or absences or any accommodations that are needed. Walk yourself through the worry, get the information and the facts so that way you know what your next steps will be and how comfortable you will feel to share more information. And then my second point is, will you feel better if you tell your employer? So this is a very personal decision. Know that a lot of people worry about sharing too much information and the perception of an employer and what they might think of you. So there is sometimes often a lot of stigma associated with sharing about an illness and being perceived as not as productive or valued. And these fears are normal, but it does not mean that they are true, right? So sometimes we have to walk ourselves through this. And then remember that we all deserve to have privacy when it comes to our health and our personal life, but sometimes our health can be unpredictable or triggered by stress. And you have to ask yourself, is the value for my privacy more important than the accommodations I may need? And then my final point is listen to yourself. So you may have to do a little bit of reflective work and address your fears and concerns prior to having a conversation with your employer. And you need to ask yourself, what do I need for success, right? So my key point here is that mental health is an important part of decision-making process, and it should be heard.
Thank you, Harprit, for the stimulating presentation.
I'm almost done. If I can just go through my summary. And
I'm sorry. You said it was your last point. I'm sorry about that.
It's okay. So really quickly, no one can tell you what to reveal to your employer. This is a very personal decision, and you should factor in your own unique health history and your situation when talking to your employer. And don't rush to share once you've obtained a job. Think about what the conversation will be and what you want to talk about. Reflect on your job responsibilities, the agencies, the resources available to you, and if you'll need accommodations and resources to support your success. And then remember that revealing information is up to you. And again, there are rights built into our laws and legislation to protect you from discrimination and mistreatment. And I wrote here, weigh out the pros and cons, because sometimes it just helps us to make a list. I know I like making lists, and every situation is unique. And at times when we look at a list, we can really see what's fact and fiction and what are the things that we really need to worry about. And then as I most recently discussed, mental health. So worry and anxiety at work, you have to think about this. Is this a healthy experience for you? What kind of state of mind do you want to be in when you go into work, especially if you have an illness like sickle cell, which can be unpredictable for many patients. So learn the policies of your employer and determine if you will need access to accommodations. And if you don't need accommodations from your employer, is there any benefit or value for you to share? So this is a very personal decision. And if you have any thoughts, you're welcome to share. And we're at the end of my presentation. I just wanted to thank everybody. Oh, you're on mute.
One of those days. Sorry about that. Thank you for pointing that out. Again, thank you, Harprit, for this presentation. Very much appreciated. And like she mentioned just now, if you have any comments or questions, please post them in the chat, either the Q&A or the chat function as well. So we will be taking those questions on. A takeaway for me from your presentation, Harprit, is that the how and why of advocating is really a personal pathway. And with the information you've shared, we're equipped with relevant guidance to carve our own paths. That's my take on it, and I appreciate that. Thank you very much. So that brings us to the Q&A section. If you have your questions, please post them, or your comments or any thoughts you want to share, please post them, and I'll go through them as we go along. All right, so the first question I have up here, I think it applies to both of you, and I'd like to hear from both your perspectives. Devan from the government advocate's perspective, and Harprit from the social workers advocate perspective. The question goes, are you able to share real cases from your experiences of advocacy and learnings that arose either for you in your own work, professional work, or that could be applicable to patients and caregivers? Let's start with Devan.
Yeah, I think even when I think about the work that we've done with SCAGO over the past couple of years and the leadership that Lonrej and the rest of the organization have shown, I think demonstrates a lot of the pragmatism in what I talk about on effective advocacy. These are passionate advocates for individuals living with sickle cell and their families. But there was a recognition, for example, that there was a need not just to go in and argue for the problems and bang on the table for the solutions as much as they were warranted, but that there was an opportunity to build champions and to find individuals who could see this as something that they would want to be supportive of and find more ways to support. Because by building those champions, you're taking the opportunity to educate, and by having successes, you can then build on more successes. So I think back to the work that was done a couple of years now ago on Bill 255, which was to create the Sickle Cell Awareness Day in Ontario. And that was done as a private member's bill, was done as a co-sponsored bill with two PC party MPPs, one of whom is now a cabinet minister. And, you know, there wasn't a lot in that was going to immediately benefit individuals living with sickle cell. But it was a powerful opportunity to educate people within government about this group of people in Ontario, growing group of people in Ontario living with sickle cell, and the fact that their unique needs and considerations had to be respected and had to be addressed within systems. And since that has happened, since that was created and since that day was established, we've seen almost a mushrooming of opportunities that SCAGO has been engaging in terms of providing better care, better supports to individuals living with sickle cell. And a lot of that came because people were able to take a positive step that gave them a sense of ownership in trying to work towards a solution. And the first thing that Laundrie and others would encounter when she'd go back to these MPPs or go back to these government officials was, what's the next thing we can do? What's the next thing that we can do to help? Right. And so you had made allies, and those allies then were committed to trying to help you navigate their systems and their institutions to make positive impact. So it's a constantly step-by-step, I use the word iterative. It's always an iteration. It's always 2.0, 3.0, 4.0, 5.0, the next version. You know, it's so tempting to want to, you know, run up the stairs and get to the top because we know what the perfect outcome is, but it's a process to get from one to the other. So those early moves, that why they may seem symbolic, can really build some momentum to start moving forward on the things that are going to have profound impacts in people's daily lives.
Thank you, Devan. And I do want to take the message back that we are appreciative of the work that has been done and the achievements to date. Thank you very much. I'm taking from your presentation to make that comment. Your thoughts, Harprit?
Sorry, do you mind just sort of reminding me the question? So in terms of healthcare?
Yes, are you able to share any experience, real cases from your experience, and any learnings, key learnings that you taken from that?
I mean, advocacy is definitely, it's important work, but it's also very challenging in a healthcare institution. You know, patients have perspective that we have a lot of power to be able to influence employers or institutions like schools to be able to accommodate, which sometimes we do and sometimes we don't. In our clinic, we do try to start from the beginning. If we know someone is starting a new job or they've already brought up that they will need accommodations, the physician and I will create a letter and we'll try that way. Sometimes documentation comes through, but there's not always a guarantee. And I think that's the challenging part, is that not a lot of employers understand sickle cell. And even if you do try to show that you are, you know, you're a healthcare institution, that this person is being followed, these are the limitations, these are some of the pieces that can affect them. At times it can be a double-edged sword because, you know, maybe because we've had patients that have been in, you know, really in jobs where they're outside, or they're dealing with altitude changes because they're a pilot or a flight attendant. And then you write a letter that says, you know, a sickle cell crisis can be triggered by such and such thing, and they're going through a medical review. So at times the advocacy, you know, you're like, what's too much, or will this help you? Or then the next step is obviously to figure out how we can reassure the employer or support the patient to feel like them being connected to us is still really important and that we are able to effectively advocate. So in summary, it's often tricky, but important. And I think that we also have to remember in hospitals that our patients are really looking at us with a lot of hope, and hope that we can move something along for them so that they can be treated normal, right? And have a normal experience like everybody else.
Thank you for that, Harprit. This is a collaborative process. It is challenging, but the rewards are immense. So thank you for the principles you shared with us here. I have a comment, a question here. It's directed to Devan. I like your pragmatic approach to advocacy. Do you see a role for social movements in your advocacy style?
I do, and I do think it clashes at times with the impulse of a lot of social movements, because I think there's another advocacy approach, which is direct action. And direct action has a long history, and I understand that. And direct action has achieved a lot of things. But direct action is highly confrontational. And unless you can really own the space and sort of bring the moral persuasion of a very big and increasingly fragmented society along with you, it almost can lead to a more likely impact of you just make people very angry and not very supportive of what you're doing. I'll give you an example. A number of years ago, some people, if you live in the Toronto area, will remember that a sort of social movement regarding the Tamil community here in Toronto decided to basically occupy and shut down a portion of the Gardiner Expressway during rush hour on a weekday. This was a very effective way to put the issues of the experiences of Tamil people in their home country of Sri Lanka into the public eye. It was a very poor tactic in terms of building support for that issue, because all it really did was get a lot of people to associate it with a negative situation, not be very sympathetic to the argument, just thinking about how it inconvenienced to them. And that sort of became the only story that came from it. I think most people would remember that. They don't really remember what the message was. So I do think there is a place for sort of social movements to use this more pragmatic approach. But it can be frustrating because it is a slower approach. It is an approach where you have to sometimes be more positive, or at least be more collaborative than maybe your heart wants you to be, because you know what the right outcome should be. But it's just the reality that our world doesn't always operate in that way. And I think about some of the powerful direct action of the past, which achieved incredible things, societal changing things. But I'm also reminded of the fact that that was in a world where, if you were living in Canada, you had 2 television stations. You had, 1 or 2 newspapers. You had a society that was much more, everybody got their information from the same place. Everybody's attention was focused in the same place at the same time. So that's not how we work anymore. In our world, we're constantly repeating ourselves just to hope that a few people hear what we have to say. And so I do think that this approach that I outlined lends itself well, because it's about consistency and persistence and the accumulation of small gains and building up a coalition of people who are invested and supported in a positive outcome, whether it's a big thing in a social movement case or even in a personal thing, and getting a better situation for you or your loved one within an institution.
Thank you very much, Devan, for that response. Our next question goes to Harprit. It asks, what are your options if your employer refuses to provide accommodations?
Good question. It's a tricky question, and the perspective I'm coming from is a social worker, so I'm not going to give any legal advice, though that is something that you could choose to pursue, is to speak to a professional in the legal field to help you figure out whether this denial is valid or not. A lot of organizations do have, at least big organizations often have a process that if you disagree, you could grieve. I think I would need more information for this question, because the accommodation request, really, again, remember I talked about agency size, and it just does depend on who the employer is, but that doesn't mean your accommodation isn't valid, right? So why you're requesting this accommodation. Then my question is to you, what have you revealed to your employer so far about why you're requesting this? And have you asked them what they propose? And like, if you can't give me this accommodation, is there anything else that you can do to support me so I can succeed at work, right? So I think that, you know, if I was supporting a patient in this situation, I think the two of us would need to sit down and talk a little bit more about what you're asking, the type of work that you're doing, and like how far are you willing to go to fight for your rights, which are very important, and they should be. We shouldn't always just, if someone says no to us and we feel that we can do our work, but we need support, I don't think we should just sit down and say, okay, you said no, so I have to suffer through it. Maybe it's just coming back to the table and having a healthy conversation about what really you are asking for and how they can support you. So I hope that answers that question. And good luck.
Thank you, Harprit. Thank you for that response. There is a follow-up question, so maybe you just want to qualify a bit. I think it's from the same person now. Do you have to say you have sickle cell to the employer to get accommodations?
So, you know, I work in a hospital. I can speak to that piece, which is that we have an occupational health department. So if you've got a large employer and you have this department that helps staff figure out what accommodations they may need, the occupational health department may need to know, but the employer or manager might not need to. So it's kind of a yes and a no. I wouldn't say yes right away. I think that you need to look at like the institution or organization that you're working for. And even having a conversation with your family doctor, which I know sounds kind of like, oh, why? But so that they can also help support you to explain your illness, because sometimes it's really hard for us when we've been living with something for a long time and how to articulate that, right? Even though you're an expert in your own health, sometimes self-advocacy and finding the right words are difficult. You could start with, you know, sharing with your employer. Again, I'm not saying you should do this, but it's just an idea that I'm just wondering, you know, if someone has an illness, like, or has a chronic illness, like how they usually communicate that information to you. Like, what are the processes? What are the policies? Maybe doing a little bit of homework as well too for your organization to find out what actually is there that you need to provide to them, because every employer is different. And if it's just you and one other person, right, then you need to think about that relationship that you're going to be building as you work with them and how closely you work with them. Like maybe you never see each other and you're just subcontracted, or, you know, you both, one person works in Calgary and one person works in, I don't know, like Manitoba, right? So like and you just never see each other and it's all virtual. So why do they need to know? Like, you need to think about what the importance is, what the accommodation needs are when you're thinking about disclosure like that. That's just my perspective.
Thank you very much. Happy for sharing your perspective. So the audience, please, as we take our next question, kindly take a minute to complete the SCAGO poll, which will now be launched. Give us feedback on this presentation and as to what you would like to see happen next. So thank you very much. We have another question here. It's for Devan. How do you maintain hope if you're not seeing results?
Well, that is always hard. And I think the best way I would kind of look at it is twofold. And obviously this is going to apply more if you're looking about government change or institutional change. I think number one, it is sort of going back to that first part that I talked about of having that good case, that well-presented case, and that timely case, and really being reflective about whether you have truly achieved those three pieces, or if there's something that you could be doing better. Because more often than not, if you're not seeing results, that could be instructive as to why that's not happening. Something is falling short. So talking with people who you trust, who you believe have insight, or whose feedback you can take and not feel attacked or criticized unfairly about how it could be better, I think that can help. I think the other part is about the comment that I made about being realistic. It's very easy to get discouraged if what you are trying to achieve, if you're shooting for the moon before you've even gotten off the ground, you know, it is incredibly easy to get discouraged because you are wanting to achieve such an incredible outcome. I would be thinking more, what are steps along the way that will be both rewarding and meaningful progress that are going to give me a platform to take another step. Because I will tell you, in our line of work, it is immeasurably easier to achieve those big goals if you have a ladder to stand on, that you have created steps along the way that you can build on, so that for those individuals you're working across the table from, so to speak, will see this as the next step in something they've already embarked on, as opposed to they're starting from nothing and have to transform the world. It's daunting. And especially if they have other priorities and other issues at hand, it's very hard to consistently persuade them that they need all that attention. All of their attention needs to be focused on this. So that's what I would suggest, and to recognize that, you know, short-term defeats do not mean that, you know, that long-term failure, right? You know, it's the old adage of, you may have lost the battle, but that doesn't mean you've lost the war, right? So that these are going to carry forward, and a temporary setback does not mean that that you will never realize success.
Thank you very much, Devan, for that. For time, I think this will be our last question, and I think it can be a quick one. For both our panelists, we shared a lot of information today, but the question now says, what will be one key advice or action that can be taken immediately for an SCD patient to advocate for themselves? Both panelists, just one quick action, immediate action.
I can go first. I think it's communication, talking to others, speaking to your network. That's your friends, your family, your peers, and just talking, because through talking, we do sharing, we heal, and we realize what are the things that we need to stand up for.
And actually, building on Harprit's point there, I would say that that's one of the first things I would talk about, would be asking yourself, you know, whether it's at a personal level or at an institutional level, who is my advocacy team? And start putting that team together, at least in your own conceptualization, because once you kind of know who that is, who that group is, you can then think about, well, how can they help me? And what are the problems I need them to help me with? And I think that's going to be such a powerful piece, because I think about an individual in an emergency room suffering from an SCD crisis, in tremendous pain. They can't be an effective advocate for themselves in that moment. So who is their team? Who is that person that can step in to speak on their behalf? That if all they can do is to let somebody in that emergency room know that they have to talk to this person, and then that person knows exactly what needs to be communicated, you know, that's a huge positive step right there. To, you know, when you have somebody coming in and they don't know what's going on as a practitioner, they're seeing someone in crisis who can't communicate clearly because of the anguish they're feeling, being able to get them to somebody who knows what needs to be done and can communicate that clearly, you know, that's powerful, right? So, and that will be across any of these things. So figuring out that team, I think, is a great first step.
Thank you very much, both of you, for the responses you gave to that last question. As we close out this summit session on advocacy, I would like to wholeheartedly thank our panelists, Devan Sommerville and Harprit Gill, for the engaging discussion and valuable information shared. And thank you to our audience for being here and being a part of the conversation. Thank you. This marks the end of this session. Please complete the poll before you leave. And I look forward to seeing you at the last two sessions for today. We have the Solving the Access to Innovative Therapies puzzle discussion, which will be holding between clinicians, people with lived experience and industry, which is starting at 2:45 Eastern Time. And we also have the closing remarks from Ms. Larry Tunjejayi, for the CEO of SCAGO, starting at 2:25 Eastern Time. Thank you very much, everyone. See you soon.
Thank you.